Hello everyone. Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Equipoise. This audio podcast is part of the Lab Storm Motley. This audio podcast is part of a Storm and Scuttle and Turbulence. This audio podcast as part of the Squakish series or edition, and this audio podcast as part of a Storm Robotics production. Through this audio podcast today, I look at sort of the bases, some of the bases in around renal and physical activity. Before going into this audio podcast, there is literature in around this, and sort of before a certain time. Physical activity works in around the specialty as far as literature is and had been concerned, had been somewhat insubstantiated. However, there are now researchers and academics in around the specialty who have developed various evidences in around the specialty, and a link and an interlink with sort of different aspects pertaining to physical activity. So in this audio podcast, sort of an overview. So to begin with, muscle strength, uremia, and KRT or RRT, or kidney replacement therapy, or renal replacement therapy complications, and activity levels or physical activity levels in around CKD recipients are conventionally lower in as part of the literature. Further deteriorating of basic activities of basic activities and sort of daily living can increase the all-cause mortality. That is to say, listeners and viewers, that deterioration or in around basic activities can affect sort of daily living, and thus increase the all-cause mortality in around the CKD population, and CKD population being both pediatrics, young people, and in amongst the adult recipient, in amongst the adult nephrology or renal population. Moderate intensity physical activity offers sort of cardiovascular protection and metabolic advantages or metabolic benefits. Most recipients on the form of RRT or KRT, referred to as or known as hemodialysis, tend to be more prone or susceptible to CVD, cardiovascular disease, or cardiovascular-like symptoms. At the same time, patients or recipients in renal failure or those with renal insufficiency can have reduced physical capacity, and again have sort of high probabilities of cardiovascular-like symptoms owing to how there can be detriment or abnormalities in around the specific biochemical or electrolyte aspects in around the pathophysiology of and in around the kidneys. physical activity should be considered as a well, in literature, listeners and viewers, that physical activity is considered, or has been considered, I should say, that as a form of prevention in around and again in around primarily in around cardiovascular, more so than renal pathophysiology, and in addition, as a form of rehabilitation. Now, in literature, in more recent literature, there have been works by, for example, musculoskeletal and physiotherapy teams that have focused primarily on the rehabilitation aspects of physical activity in amongst the renal population, more so than the than the CVD or cardiovascular disease, or cardiovascular disease like symptoms or symptomology. Physical activity programs, as suggested, is in amongst the literature, have been suggested to help in making in renal recipients QOL, or quality of life, better. So in around some of the advantages of physical activity, and um, although although generally within varying specialties of in around varying specialties around to organ transplantation and other sort of specialisms, generically, there are publications to inform around varying advantages of physical activity. However, physical activity can help increase the estimated glomerular filtration rate in some literature, where it has been evidenced or documented as at least around 2.62 mil per min per 1.73 meters squared for example, those recipients or patients who are for example, prepped, or being prepped, or have been prepped for a form of RRT or KRT, and at the same time, physical activity can or could improve in around the following: endothelium mediated vasodilatation, which generally thus means that through physical activity there can be an increase in blood flow, even in recipients with a low hemoglobin, for example, or lower hemoglobin or anemia-like symptoms, where, for example, there's an increase in blood flow through endothelia, through renal pathophysiology endothelia, thus prompting, for example, the vasodilator bradykinin to actually increase blood flow to within renal tubules, or afferent arterioles, for example, afferent and efferent arterioles, thus increasing blood flow, which in literature is referred to as vasodilatation. Then additionally, there is increases in sympathetic nervous system activity, reduces urinary sort of components in around protein. So there is literature to inform that protein in amongst populations can be affected, owing to sort of varying prompts. So physical activity can help reduce sort of the urinary urinary excretion of important proteins. Additionally, there can be an improve again in renal blood flow and residual renal function or kidney function in amongst CKD CKD populations, and additionally decreasing ABP, arterial blood pressure, and delaying sort of a renal insufficiency sort of generally. Additionally, there is an improvement when literature informs there is improvement in health related quality of life, or HRQOL, as a result of enhanced well-being or wellness and improved physical functioning. In around the risk factors of decreased physical activity. So decreased physical activity in, for example, CKD recipients, including and irrespective of whether in and whether on a form of KRT, KRT or RT being PD or peritoneal dialysis, and in HD or hemodialysis, and or in amongst solid organ transplanted or SOT or recipients. So there can be the following additionally, wherein the risk factors in around decreased physical activity. So this increases mortality, adverse clinical events, impaired renal function or renal insufficiency, increases probability, again sort of a higher probability of renal insufficiency, and in solid organ transplanted recipients there can be a reduced renal allograft prognoses. In amongst physical activity and hemodialysis recipients specifically, physical activity is related to improved physical capacity and helping in the control of chronic illness or chronic around the chronic condition, including renal, including in around the general pathophysiology of renal disease, or in around the renal etiology. Studies have shown, for example, that physical fitness level in the form of RRT or KRT as hemodialysis in hemodialysis recipients tends to improve functional levels, and that is to say functional levels in around, for example, in around the sort of physical aspects of physical fitness, and well-being, wellness, and in around aspects pertaining to in around sort of the HRQOL, health-related quality of life, and additionally in around sort of aspects aligned to the sympathetic and parasympathetic nervous systems and the central nervous system, and thus additionally in around the cognitive aspects. Because in amongst literature there is evidence to inform that in hemodialysis recipients and in peritoneal dialysis recipients, reduced physical activity, for example, can severely impair the cognitive aspects of the renal pathophysiology, and additionally in around the sympathetic and parasympathetic and central nervous systems, owing to the uremia, sort of a symptomology which can severely affect sort of the the metabolic sort of aspects in around and through pathophysiology. So additionally, physical activity is important for recipients on PD, on both on PD and HD, in improving sort of the physical wellness. And physical activity can also improve body function and physical capacity, which will and should sort of benefit recipients on HD hemodialysis, and help in around ABP, arterial blood pressure, and in around oxygen flow. Having said this, at the same time, those on different forms of RRT or KRT, there is some evidence in amongst more recent literature that whilst there is advantages, there is an aspect that is still or an area or a focus that still has not been sort of understood, and that is to say or inform that in amongst the literature there has not been much research or investigation around the effects of oxidative stress in amongst physical in amongst those on different forms of RRT or KRT, in around and the sort of oxidative stress, that is where for example, owing to the demand in around oxygen, in around the demand of oxygen for blood flow within our organ, within in amongst in amongst the general organs within the body generally. So additionally, a look at a little bit of look at low levels, the sort of consequence or effects of low levels of physical activity. So low level of physical activity would or is expected in amongst recipients with issues in around malnutrition, where there's inflammation and disease, and making a typical association between sort of in around sedentary behavior or attitude and higher mortality. That is to say that in amongst literature, there is some evidence to indicate that those with lower levels of lower levels of sort of, for example, in around motivation or enthusiasm, and sort of the sort of what's referred to as sedentary attitude or behavior, can lead to higher mortality or higher mortality rates. Lower physical activity capacity, sort of muscle wasting. Muscle wasting, unfortunately, is a sort of a symptomology in around the renal syndrome, owing to the deficits that can and do occur in around the biochemistry, or in around the biochemistry of and in around the workings of the renal, in around the renal pathophysiology. So there can be muscle wasting and poor physical performance, which can be highly prevalent amongst patients or recipients with ESRD or ESKD, and potentially where especially wherein wherein evidence also indicates or informs that that physical activity in amongst literature is used as a is used or is implemented as an intervention. So in where physical activity is implemented as an intervention, then unfortunately there is or can be sort of higher capacity in around sort of the low where there can be high capacity in low physical activity, and that can be more sort of issues in around muscle wasting and amongst a particular literature and evidence. Low level of physical activity is also associated with development of disabilities, and again, because in RRT or KRT recipients, there can be sort of detriments in around the biochemistry aspects, and thus prompting sort of a faster decline in around physical functioning, and thus also causing issues in around in around aspects aligned to disability. And this then also unfortunately can lead to a loss of independence, and then loss of independence, and then challenges sort of and challenges sort of more challenges sort of more generally in around physical activity and inactivity, sort of as an addition as sort of additional sort of additional understanding is that in amongst dialysis recipients who can be extremely can be extremely inactive, specialists, renal specialists rarely have assessed sort of the physical activity levels in recipients, and or counsel recipients or patients to increase physical activity. At the same time, the lack of physical activity assessment and counseling is multifactorial, related to such factors include competing medical or clinical syndromes or clinical issues, and also where there can be a limited time available for physical counseling, for example, and a lack of sort of a lack of a almost wherein there is a lack of a prescription basis in around physical activity. Although that being said, again, coming back to as per said in where literature has informed that if physical activity is prompted as an intervention, then evidence also indicates there is a lack of motivation, or where there is a sedentary sort of attitude or behavior, and thus where if and where physical activity is prompted or is prescribed, then there is also some evidence to inform that there is less probability for recipients to want to or to enjoy aspects pertaining to physical activity. At the same time, At the same time, in around physical activity risks. So some of the most common sort of challenges or common challenges or risks during physical activity in amongst renal recipients, irrespective of SOT recipients, solid organ transplanted recipients, and on irrespective on RRT or KRT in the forms of hemodialysis or peritoneal dialysis. There is there is a high there is or can be a high probability of musculoskeletal injury. Excuse me. The risk of adverse events is higher with a high intensity of physical activity than submaximal physical activity. Musculoskeletal risks may be increased in CKD recipients with as a result of, for example, in around the symptomologies where the parathyroids are affect where the parathyroids where the parathyroids are or can be effective, and so where as a result of hyperparathyroidism and in around the symptomologies leading to bone mineral disease or bone mineral like conditions. Um, so in around a little bit of a look in around or delving into in around in around in around and in around looking at or delving into strength training. So weight bearing and strengthening physical activity could decrease or can decrease the risk of falls, for example, and increase bone density, reducing and reducing risk fracture. The risk for injury can also be minimized by including a sort of a warm up duration through physical activity sessions, and by avoiding high impact activities, since high impact physical activity in amongst at least in amongst some of the literature amongst some of the literature has informed, for example, that there can be an increase an increase in the symptomologies leading to bone mineralization, and so there can be issues or challenges in around high impact activities. Hence, in CKD recipients that sort of literature prompts sort of avoiding sort of a sense of avoiding high impact activities. Beginning sort of training programs, for example, or wherein training programs or physical activity programs exist, lower intensity and progressing gradually is where renal pathophysiology is and where there is a sense of tolerance. And then in around physical activity, a little bit in around physical activity investigations. So medical screening before physical activity participation can help determine which recipients are at increased for CVD or cardiovascular like disease and or implications. Screening should be related or regarded to the sort of the proposed to the level of intensity, in around the level of intensity of training that recipients may have in questions around, and recipients, and additionally in around recipients symptoms or symptomologies, and in around in around sort of the condition status. And bearing in mind, listeners and viewers, that each sort of CKD condition, since each CKD conditions can have varying symptoms or symptomologies. At the same time, patients with diagnosed with for example, cardiovascular-like conditions, cardiovascular-like conditions aligned to and in line to sort of where renal pathophysiology is also affected, should undergo it should undergo sort of screening before participation in amongst sort of for example, vigorous or other sort of physical activity programs. In around assessing physical activity, musculoskeletal limitations can be further assessed through referral to a physical therapist. Cardiovascular-like symptoms or warrant sort of assessments in around stress testing or stress screening. In around sort of guidelines there. Um, so published KDOQI clinical practice guidelines on sort of management of cardiovascular like symptoms have informed have informed sort of retrospectively that all KRT or RRT recipients should be counseled and routinely encouraged by renal or kidney specialists and dialysis or KRT or RRT professionals to increase the level of physical activity. Some existing guidelines provide sort of some assistance, but at the same time there is a little in around determining whether physical activity screening should be performed before and sort of more sort of before and more and sort of more routinely as part of RRT and KRT practices. So look at now steps to increasing some steps to increasing physical activity. Teams should determine whether recipients can perform at least 30 minutes of moderate activity on three or more days per week. For example, if recipients are not physically active, it is important to investigate the hindrances or barriers, including specific questions about musculoskeletal limitations and in around cardiovascular like symptoms such as for example chest pain and dyspnea. So now just a little bit in around the summary, a bit of a summary. So physical activity programs within a KRT or RRT settings have the potential to be great, have the potential to be of great advantage. It is impractical to consider a program without sort of a sense of a universal support or consensus of healthcare professionals, because the burden of maintaining an in center physical activity can cause some impositions in around physical activity. Additionally, it is one strategy to improve estimated glomerular filtration rate, reduced ABP, arterial blood pressure, and also in around sort of the symptomologies or precluding some of the symptomology that lead to some of the comorbidities in addition in around sort of the primary health conditions. And also physical activity can prompt sort of social advantages, social advantages or social component to and for for those who are on different forms of RRT or KRT. That draws this audio podcast to a close. This audio podcast, as part of as part of the Equipoise. This audio podcast is part of the Labstorm Motley. This audio podcast is part of the Storm and Scuttle and Turbulence. And this audio podcast as part of the Squakish Series, a series and or edition.